That was a video of Peter's mom right before they started treatment. They were both very reluctant to have him enrolled here at Babbling Brook. This was because they didn't think he had a problem. It's actually a very common misconception to have that men do not have anorexia nervosa. Even though anorexia nervosa is predominant in women, there's about 2.4% of men who have this disorder. While there are more documented cases of women with anorexia nervosa, a lot of research has shown that this may be the case because women are more apt to discuss their symptoms versus men. Initially, it was necessary for Peter to be admitted to the hospital because he had reached a dangerously low weight and he'd been experiencing symptoms of severe malnutrition. These included dizziness, fainting, anemia, heart arrhythmia, which is an irregular heartbeat. In developing a therapy plan, it was critical to assess the psychological aspect of Peter's disorder rather than just treating the physical symptoms. We used 2 different types of therapies to treat Peter. Pause for a second. You gotta lift it higher. I can't see like the bottom half of that.
Okay.
Can you go back a page? Like the last 3 lines I couldn't see. Okay. Sorry. It's okay. We used 2 different types of treatment. Okay, so we used 2 different types of treatment for Peter. We used one-on-one sessions where we employed cognitive and analytical therapy, which focuses on body education, feelings, challenges, thoughts, and assumptions. We also used manualized family-based therapy, which focuses on uniting the family members' goals, not criticizing the patient, and externalizing the illness. This is highly effective form of conjoint therapy, especially when treating adolescents and young adults. If family members can be present throughout therapy, this significantly increases an individual's chance of recovery. Though it can cause some emotional stress at the onset, opening the lines of communication between a patient and his parents can provide the support network necessary for full recovery. Peter and his mother have become increasingly open-minded about accepting his anorexia, which has made them much more receptive to the treatment. So next. All of the behaviors that Jesse just described are classical signs of anorexia nervosa. The increasingly socially avoidant tendencies are generally because an individual becomes so obsessed with their issues that they can't keep up with social life. Okay, I'll try that again.
Redo.
With their you can't keep up social life. Okay. So all the behaviors that Jesse just described are classic signs of anorexia nervosa. The increasingly socially avoidant tendencies are generally because an individual becomes so obsessed with their problem that they can't keep up a social life. The oversized clothing is to conceal their weight loss, and playing with the food is so that people don't notice their self-destructive eating problems. Bringing Vanessa here was definitely the right thing. It was definitely a good move on Jesse's part. While we completely support family involvement in the rehabilitation process, many people do not realize how severe anorexia nervosa can become and how important the role of a professional therapy can play in successful recovery. Although Vanessa was angry with her sister at first, through therapy she has realized how altered her thought process was and how thankful she is that her sister helped her seek help. Because Vanessa is coping with her disorder while away from home, and this because of the severity of her anorexia is only moderate, we focused on individual outpatient counseling where we used rational emotive therapy which Vanessa described is a form of cognitive behavioral therapy. Cognitive behavioral therapy is one of the most commonly used therapies used for patients who have an illness for a shorter duration and who can be successfully motivated to strive for recovery. In Dylan's case, cognitive...
Just in Vanessa's case.
Just in Vanessa's case, yeah.
In Vanessa's case, cognitive behavioral therapy proved especially successful. In helping her uncover and cope with her internal risk factors, perfectionism and negative body image, as well as understanding the role of external stressors of college life play in the onset of her anorexia. While some clinics employ the use of antidepressants, antipsychotics, and other pharmaceutical treatment methods, we generally focus on psychological therapy rather than medication prescriptions here at Babbling Brook. To date, studies have shown inconclusive results regarding the success of medication therapy, especially during treatment. And we believe that the potential side effects are not worth the risk. We do have a psychiatrist on staff who can prescribe medication when necessary, such as treating patients who experience comorbidity. This is where they have anorexia nervosa as well as another treatable disorder. And that's it.
Yay! Okay, good.
Wait, are you a clinical